Kendall, Klugh, and I'll be performing a wet to dry dressing change today. Today's date is February 10th, 2018, and the course is for Fundamentals of Nursing 1. So to begin, we verify the patient. So in order to verify the patient, we have to check the chart and the armband that is on the patient. It seems to be that the patient is verified. The next thing to do is verify the physician's order. The physician's order seems to be verified. And the next thing you have to do is ask the patient, do you have any allergies? The patient says no. Do you need any pain medicine before we get started on this procedure? Because what I am doing is I will be removing your old dressing and putting a new one on top of the uncovered wound. The patient says no, they do not need any pain medication. So next I have to make sure that the bed is at the correct height for me to be able to do this procedure. It seems to be that the bed is at the correct height. Next thing that I have to do is provide privacy. So I will pull the curtain. So now that I've provided privacy, I will go and I will do hand hygiene. Next, I will be putting on clean gloves. And I will take my biohazard bag. Next, I'm going to put the I'm going to put a towel underneath the patient to absorb any drainage or anything that may come about during the wound assessment. So now I have to position the patient. So I have positioned the patient, and now I'll be removing the old dressing putting in the biohazard bag. The next thing that I have to do is create a sterile field and measure the wound. But first I'm going to go ahead and measure the wound. So the wound seems to be about 11 centimeters in length and about 6 centimeters wide, and this is considered sterile. And about 5 centimeters in depth. So now that we have measured the wound, I will create my sterile field. And by doing this, you can only touch the outer edges of the field. These are sterile gloves, so it's okay. Okay, so now that I have created my sterile field, I'm going to go ahead and position the patient onto it and remove my supplies from this bucket because the outside is not sterile. Okay. Okay, so now that I have done that, I will remove my clean gloves, and now I have to do hand hygiene one more time. Next, I have to remove my sterile gloves. from the packaging. Be careful to only touch the outer edges. Okay. Can you stop? So I stopped the video because my glove messed up, but I have redone my sterile gloving. So now, starting back over to what it would actually look like, which would be that. Now that we've gotten our sterile gloves on, I have to clean the wound. Don't know why that's stuck on there. Okay, so clean the wound. Now that I've cleaned the wound, I will pour the solution into here and make this gauze wet. You will use this Q-tip applicator to help you position the gauze into the wound. Being careful not to touch the outer portion of the wound. Please don't roll over. Okay. Alright, now after you do that, you take your 4x4 gauze and you place it top of the wound. And then you take your tape and you will tape it down. And next, I will remove my gloves. And I will date and time and initial the wound dressing. Okay, and that is how you do a wet to dry dressing change. So now that we have finished our dressing change, we have to assess the patient and make sure that they're okay. So, are you okay? Do you need anything? And I also have to perform hand hygiene one more time. So I'm going to go ahead and do that. Okay, and now we have to position the patient and make sure that they are in a comfortable position. So my patient seems to be in a comfortable position. So next I will have to remove these supplies off of the table. And I do need gloves to do that. This part, it doesn't necessarily have to be sterile. So I'm just going to go ahead and put them on. Anyways, like I said, it doesn't have to be sterile, so just gonna go ahead and just shove these out. Did I do the right hand? I hope I did. Okay. So position the patient, and now remove these supplies. We set it all in a biohazard bag and take the biohazard bag to the biohazard room. And then next, all we have to do is just make documentation of what you have done this evening. So, and that is how you do a wet to dry dressing change.